Hogg Foundation policy team serves as a resource to influence systems change intended to improve the mental health and well-being of Texans, including historically underserved populations in diverse communities. We seek opportunities for collaboration where we can add value to ongoing policy efforts and identify new opportunities to promote systems improvements. We believe this is achievable through focusing on strategies that impact community mental health and well-being, supporting historically underserved communities and access to services.
Community health and well-being means all Texans should thrive in communities that support mental health, achieve health equity, and promote well-being. This applies to areas including safe and supportive schools, suicide prevention, a public health approach to substance use, and peer support.
Individuals' mental health and well-being should be supported and protected regardless of where they live, how much schooling they have, how much they earn, what they look like, what language they speak, who they love, or how and if they worship. This applies to areas that include supporting community drivers of health for underserved communities, LGBTQIA+ supports and resources, rural communities, mental health and intellectual and developmental disabilities, comprehensive community support for system-involved youth like child welfare and juvenile justice.
Every Texan should have equitable access to mental health and substance use supports and services, from prevention to intervention to recovery, that are appropriate, affordable, and accessible when needed. This includes the behavioral health workforce, maternal and postpartum care, Medicaid networks and reimbursement rates, mental health and substance use parity.
The Hogg Foundation for Mental Health provides education and technical assistance to legislators, their staff, state agencies, and more.
One of our top educational resources is the Guide to Understanding Mental Health Systems and Services in Texas. The guide is a neutral, data-driven resource on mental health and substance use systems and services, funding, and various pressing policy issues. We update the guide to coincide with each legislative session to help inform mental health and substance use policy analysis, development, and decision-making.
For more information about us or to discuss how we can support you or your work, please contact our policy team.